I'd like to speak a little bit about diagnostic testing that we do here at InMotion Health Center. And we do it in the form of saliva testing, urine analysis, sometimes hair analysis, and there can even be fecal specimens. The most common one we do is a saliva test. And we do that because with saliva, you can test so many more things than just blood. And saliva, when it comes to hormones, it measures the fat-soluble component of the steroid hormones, like adrenal glands, and like estrogen, progesterone, testosterone. They all have a fat-soluble component. And blood tests the water-soluble component. So if we get both of them, we're getting so much more. So what we use the saliva and the urine analysis, the hair analysis for, is essentially hormone issues, metabolic issues, gastrointestinal, parasites, and even food intolerances and bone health. We can learn so much from these tests. So the tests are essentially done at home, and it becomes even more convenient than going to a lab. The other reason it's so convenient is you can do it 4 times a day, which might be necessary, or once a day for an entire month, depending on what is prescribed. So how we do it here is I give the patient this kit. The kit comes from us, and it's fully self-explanatory. Inside the kit, there is a prescription pad, which I fill out and let the lab know what we want. Then I hand the patient what's inside are the tubes. And in this case, we're talking about saliva. So what we're going to do is we're going to spit into this tube, and it has to go from here to here. So that amount of spit might take 20 minutes. The first time I did it, I thought I could just do it really quickly, spit and run. But I tell everybody, you want to give yourself 20 minutes. And you spit into this tube, and then you tap it down to get the foam out of there, and keep spitting until we get this much. Then you put it into the refrigerator and keep it in the refrigerator until it's supposed to go out, whether it's the next day or within a month. It takes approximately 14 business days once they get the saliva test for the results to come in. They fax them to us, and then we call the patient back, at which point we sit down with the patient, and we're able to tell them, this is how your hormones are. It's not your thyroid, it's your adrenal glands. Or you've got way too much estrogen relative to your progesterone. Or maybe your testosterone is too low. Or bone health, from a bone perspective, you're not getting the right nutrients, minerals that you need to keep a bone solid. So long story short, we find this to be a great addition and part of a holistic package that we provide our patients. And it's available at a very, very cost-effective price point.